Before you retire, there are 5 Medicare traps that could cost you thousands or even jeopardize your peace of mind. I'm Dolores, your Kingdom Wealth Strategist, and I help baby boomer wealth builders like yourself build tax-free wealth, protect what matters, and retire with wisdom, peace, and power. Today, I'm going to walk you through the 5 biggest mistakes I see every single day, and more importantly, how you can avoid them. So let's dive right in. Trap number 1, thinking Medicare is free. So let's start with this biggest misunderstanding that I see. The belief that Medicare is free. Yes, you paid into the system for years, but when it comes time to using it, you're still responsible for monthly premiums, deductibles, and copays, and there are major gaps in what Medicare actually covers. So right now, Part B, for example, the premium costs approximately $185 per month. That's over $2,000 a year just in premiums. And that doesn't even include prescriptions, dental, vision, or hospital stays. Now, remind you, Part B premiums is $185 if your income is under $106,000 or less a year. It's $259 a month if your income is between $106,000 and $133,000 a year. Now get this, it's $370 a month if your income exceeds $133,000 up to $167,000 a year. It's $480 a month if your income is $167,000 and above to $200,000. $591 a month, $200,000 up to $750,000, $628,000 if you're above $500,000. And that doesn't even include medications or hospital stays. I just don't want you to be blindsided with numbers and get caught off guard. Proverbs 21 and verse 5 says, the plans of the diligent leads surely to abundance. So let's plan now. It's so important to make preparation now so your future health is covered. Trap number 2, choosing the wrong plan. So now let's talk about something that could cost you even more money than you can imagine. Choosing the wrong Medicare plan. You might feel tempted to pick a plan because it has 0 premiums, like a Medicare Advantage plan, but it could cost you in care, in access, and freedom. For example, if your doctors that you love are not in that plan's network, you may be forced to switch doctors, and that's not a good position to be in. You might need some sort of medical procedure that your plan could require a prior authorization, which delays your care. And if you're not careful, you could end up with unexpected bills for services that you thought were covered. So that's why it's important to understand the difference between the original Medicare and what it offers, and connect it maybe with a Medicare supplement plan or Medigap plan, or you can choose the Medicare Advantage plan. The Medicare Advantage plans offers mostly 0 premiums with perks, but they come with limited access, more restrictions, and surprises you don't want most of the time. A Medigap plan, like a Plan G, gives you the freedom to choose your doctors, predictable monthly income, and it gives you a little bit more peace of mind since you can go to the hospitals. So please don't just pick a plan that sounds affordable. Pick the plan that's going to match your medical needs and protect you. Trap number 3, ignoring long-term care. Let's face it, most people don't want to think about this one. What happens if you need long-term care? Medicare doesn't cover long-term care, stays in a nursing home, memory care facilities, or in-home help with bathing, eating, or drinking. And statistics shows 7 out of 10 people that retire past 65 will need one of these cares. The cost could exceed $7,000 a month. That can drain your savings faster than anything else. That's why I want you to choose the plan ahead with tools that will give you both protection and peace. You could use a long-term care insurance policy, an annuity, or with long-term care riders. Annuities do come with long-term care riders, or an index universal life policy. These all have living benefits, okay? 1 Timothy 5:8 says, if anyone does not provide for their own, they're denied the faith. This isn't just about your money. It's about your kingdom stewardship. And it's how you take care of your future, your health, and your family. Trap number four, underestimating prescription drug costs. So let's talk about prescription drugs here, because many people assume that their plan will cover everything, and guess what? It does not. Okay, some medications, especially Part B drugs, like injections for like some eyes problems that you have, infusions, and they can be extremely expensive. And if you don't plan to cover them fully, the out-of-pocket cost, your 20%, could be crushing. Here's what I recommend you do. If you're ever in that position, use some of the third-party companies like RX Hepper. They connect you to the manufacturer discounts for name brand prescriptions. Reach out to those drug manufacturers directly. Many of the drug manufacturers assist you if you qualify for their plan. If your plan isn't helping, let me review it for you. I am a Medicare agent, and I can help you compare smarter options, okay? Here's where it gets even more powerful. The best way to lower your prescription costs is to reduce the need for prescriptions in the first place. Yes, I said it. Take care of your temple. Eat whole foods, move your body, let's exercise. Where them fans at? Yeah, sleep well, stay connected to God. 1 Corinthians chapter 6, verse 19 and 20 says, your body is a temple of the Holy Ghost. Honor God with your body. A healthy lifestyle is more than a choice. It is an investment, and it can save you thousands of dollars over the long run. Trap number 5, no cash backup strategy. So let's talk about this one plainly. Too many of us baby boomers, wealth builders like yourself, we're walking into retirement without a real backup plan. You might be dependent entirely on Social Security or a pension, but that's going to really limit you and cause you to live paycheck to paycheck, okay? But what happens when something unexpected happens, like a diagnosis, a surgery, a rehab stay? One storm could wreck everything you've worked for. It's not that you're not ready. That's why you need to have some sort of money projected, accessible, tax-free whenever you need it, so you can take advantage of it. And this is exactly where index universal life policies and annuities come in. They aren't just retirement tools. They are financial lifeboats for a senior with no savings. They give you guaranteed lifetime income, tax-free growth, optional riders that cover long-term care, chronic illness, and critical conditions. Ecclesiastes 11:2 says, give a portion to 7, even to 8. For you do not know what disasters may happen on the earth. You don't want to wait for the flood to come before you build your ark. Now is the time to prepare, because when you build your retirement God's way, you don't just survive, you rise above every storm. Yes. So now that you know the truth about the 5 Medicare traps, the next move is yours. Download your free retirement readiness checklist below. It's going to walk you through every step to secure your health care, your income, and your peace of mind during your retirement. Click the link below and grab your checklist, and let's move forward together. And if this video has helped you, make sure you like, subscribe, and share this video with someone you love so they can gain this knowledge as well. I'm Dolores, and it's been wonderful that you stayed with me till the end. I'm your Kingdom Wealth Strategist. I help you retire healthy, wealthy, and wise without sacrificing all of your time, all your energy, or your current lifestyle, and most of all, without sacrificing your legacy. Thank you and blessings.